Good morning, good afternoon, and good evening to all of you consumers, wherever you are best. And we would like to welcome you to yet another series of our Humanist TV Africa program on food and consumer safety, where we would like to add and scale up your quality of life as a consumer in both socio-economic well-being and also to empower you to safeguard the environment you live in and also to make sure that you are a positive and responsible consumer by making sure that whatever surrounds you, in whatever you engage in, and in whatever you do, you are productive and there is sustainable production. You are responsible in your consumption, and you are also responsible to making sure that there is clear and responsible production. So having said that, as a curtain riser, I would like once again to welcome you, and I trust you are still enjoying your festive season. The festive season started around about a week ago, and it is still going on until sometime next week. So having welcomed you, let me just turn my voice to Bernard to welcome Bernard, and also turn my voice and welcoming and appreciation voice to Humanist Media Africa. Also thanking and our producer, Dennis Bongole in Entebbe, our other producers and partner sisters of Humanist Media Africa, running the Humanist TV Africa way in Nairobi, in Southern Africa, Western Africa, in Europe, that bring about the global franchise. So I would like to thank you all for the support. This is going to be our last program in 2024. It concludes the programs that we started in January 2024. We have had a marathon, and I would like to say a marathon of meaningful engagement. So, fellow consumers, wherever you are, thank you for the support. If we go back to look at over the 40 series that we have held, over 100,000 views, where it started with 500, it went into 2,000. There is a time nearly 6,000 of you reviewed, reposted, and I think this is amazing. And we were going to make sure that the food and consumer safety agenda that we are running with Humanist TV in partnership in 2025, we spice it more. We bring in more consumer voices, more consumer experiences. So we would like to thank you all for being royal listeners, watchers, and even partners when you repost, when you resend, when you reshare on Facebook, YouTube, and any other social media. This is great, and thank you for increasing whoever is watching and for also playing a role to improving the quality of life of consumers, irrespective of the class. And it is proving that most of the consumers we think are knowledgeable. They are the biggest victims. So consumerism, sustainable consumerism knows no class. It only requires being sensitized, being knowledgeable, being aware. And like I say, if it is not safe, you need to think, you need to stop, you need to assess, you need to do fact check, you need to engage, And if it is bad, you need to expose. So, colleagues, today we are still looking at the consumer plight in goods and services delivery using Uganda as a case. We are looking at the health and the environment. You'll find that if the environment isn't healthy, you as a consumer will not be healthy. And when you are not healthy, the environment too isn't healthy. So when we look at the systematic approach of humanity, we are going to find some of the aspects why we are looking at health and environment together. So today, we are looking at another sector of the 9 sectors that we are in the report that we released with regards to consumer voices on the goods and services that are being delivered, the quality. So today, having gone through transport, having gone through electricity, communication, having gone through the agri-food systems, having gone through communication, financial services, today we are touching another sector, which touches you both directly and indirectly. We are victims. We are victims of many things. These consumer voices today, we're going to look at our rights, responsibilities, having questioned where policy exists, what is going wrong, who is responsible, why are we experiencing this plight with all the commitments by the duty bearers. So ladies and gentlemen, today, as I've already told you, my colleague Bernard will be unpacking a little further, bringing in live examples. But when we look at the health sector and the environment, the vagaries, the unfairness, the non-responsiveness that is affecting consumers here might be the same in your country, even in what we're experiencing in developing world. It's the same at times in certain countries that are developed. So consumer voices need to be maximized to speak out and bring out the plight and get solutions straight. Looking at the healthy sector and the environment, if I would link it to the first consumer right, health care is part of the basic needs of the consumer. And it must be safe. There must be information as your other right to enable you to do choice. It brings in the patient's rights. But unfortunately, most of the times, patients end up not having enough information, not having redress, not having representation. There's limited education. And it ends up like today's program, it starts with healthcare and ends up with the consumer right number 8, healthy environment. So today, that's why we're touching health and the environment. But all that said, consumers, irrespective of your profession and jurisdiction or your duty, because we are all consumers, but from there we become duty bearers. From there we become service providers. From there we become business people. From there we become consumers who consume what we don't produce. Even if you are at times a doctor, you might need services of another doctor. But this leads us to our responsibilities. Most of our responsibilities will find they coin in well today, that as we access health services, Medicare, the environment in which we get them, we must be critical aware. At times we are desperate when we are going in for health services, in bad shape. But we need to be critical aware. We need to question where you are getting the services. That is very key as a consumer. And if And it goes back if it is not safe. You have to stop and be critical. You have to assess, that is when you're critical. You have to do fact finding when you're critical. You have to engage when you're critical, expose. You can only expose when you are critical. And it is followed by action. When you finish being critical, you need to take action as your responsibility. Complain when you see services are not good, when the environment in which you're living, you're operating is poor. If the environment you're doing that is bad, you will not get good services. Be social concerned. You might think it is not you today, but it might be your relative, your child, where you are going to spend lots of money because you are not critical, you didn't take action, and you didn't have social concern. So that is very key. And it leads us to be environmentally aware as our other responsibility. So, need to be aware the environment in which we are doing all this. And that's why today we are looking at health and environment. Check out where you're getting those services. And leads us to the last one, which that is why we are sharing with you all these that are in the Consumer Voices report, the first annual report, so that in solidarity as consumers, being the biggest and the largest socioeconomic grouping, we need to be in solidarity because it is our money, our hard-earned money, that we pay for the services, that we pay for goods and services. If we do not get value out of it, we are less productive, there is less production, and we end up being unhealthy. So through solidarity, understanding all that we are going to share with you today, we can get this information and use it effectively in 2025 by turning around, calling to action the duty bearers, the service provision businesses, to have better businesses, duty bearers to implement policies to have quality consumer life. I would like to use the last minute to open up the discussion. Most of the consumer voices that we picked during the year, over 2,000 consumers, talked of poor customer care when they go to health facilities. They talked of exorbitant costs. They talked of poor, limited information. But what really pains, and which is going to be opened up on a number of aspects, the misdiagnosis, being wrongly diagnosed when they go to all these health services. Many people are victims. They are given wrong medicines for elements that are not there, and they are having lifetime negative impacts on their health. Others we have had fatalities, people dying due to misdiagnosis. It goes back to the biggest complaint, lack of customer care. So, ladies and gentlemen, I would like at this point in time, having given one of the longest curtain rises of 15 minutes, I would like to welcome Bernard to unpack a little further the different variables that came from the consumer voices and looking at policy aspects, looking at different actions that we need to take and we need to advocate as our responsibility as consumers. Turning around businesses to be good is also our other responsibility by complaining, by raising things where they are going wrong. So, ladies and gentlemen, I would like to welcome Bernard. Bernard, please share with us the details of the report. Thank you.
Well, then thank you, Henry, for sharing with us. It was also, I think, the longest preamble you've ever given, but I think it was necessary because now what I'm just going to add on are just a few things. I think you've really given us the good start of the show, taking us through the aspects of health. But bottom the line, when I was still a scholar of public health, we used to wonder what health is. And I thought that maybe during the course of this show, I try to share with us from the public health perspective what health is according to the World Health Organization. The World Health Organization defines health as a state of complete physical, mental, and social well being. So, are you physically sound? Are you mentally sound? Are you socially well? So, health, when you're discussing health, we are not only looking at disease. So health looks at aspects around complete physical, mental, and social well being of a person, and not merely the absence of disease or the absence of infirmity. It's not really about disease, but it's about all those factors that actually can result into the burden of disease, either physically or mentally or socially or psychologically. So many people are not healthy mentally. You see them walking around the streets, you see them in taxi parks, bus parks, and they look healthy, but actually, when they are mentally ill, there are also others who are actually socially ill. You see them, they are rich, they have the money, they have the vehicles, they have all this, but they're actually sick. We have seen groups of people who cannot be in others. If there is a meeting for them, they're isolated. All those are healthy issues. We've seen people who are weighing, for example, 100 and so kilograms. So they end up being social misfits. They don't want to associate with others because they feel they'll laugh at them. Now, even when they look healthy, they are not because they cannot socially interact. Now, what are those things that are causing all these unhealthy situations? Are things that we are diving into during the course of this discussion. Now, we're going to use Uganda as a case, and we're going also to look at the consumer issues that we gathered during the course of October 2023 to October 2024, looking at what are those key issues that came out through the consumer complaints desk, looking at health and environment specifically. And I want to assure us that government of Uganda has done quite substantially a lot of work when it comes to promoting health of the citizens. And as you're aware that every sub-county, for instance, is supposed to be having a health center 3. And every parish, I don't know that it's every parish, it is supposed to be having at least a health center 2. Now, this is the ideal, and this is how the Ugandan situation is supposed to look like. But of course, we are aware that irrespective of such commitments, there are so many parishes, there are so many sub-counties that have never had any of those health centers, and yet it is either by policy or regulation or by health standards of Uganda that we are supposed to have those. So whereas the country is doing all they can to make sure that we have a stable healthcare system, there are so many gaps in there that we need to dive into as part of advocacy of the system. Of course, credit is due when it is supposed to be credited, but when there is no need for credit, we also need to bring it out so that probably it can help governments and also consumers to advocate further for our rights. Two, that maybe the consumers need to know, we have what we call the patient charter. Patient charter is a document that stipulates the rights and responsibilities of the patient when you go for health care. It also stipulates the role and the responsibility of the healthcare provider on what they're supposed to be giving to the patient during or prior, during, and after the medical service. Now, whereas we have this charter, it's very unfortunate that even me myself, who is a consumer advocate, I learned about it when I was doing my master's at public health. So, meaning that most of the consumers out there are not even aware that we have that kind of charter. And yet, it is mandatory that every patient is supposed to be knowing the charter, their rights and responsibilities as patients. So many of the vagaries that are happening in the health sector are happening because the patients or us, the consumers, are not aware of our rights, leave alone the consumer rights, but people are not aware of the patient rights. Every patient, every time you go to the hospital, just know that away from your human rights, away from your consumer rights, you also have your patient rights. Now, I think in the next discourse, we shall try to get that charter and start sensitizing the masses about what the provisions of the charter are. For instance, in that charter, every patient is supposed to be aware of which ward they are supposed to go to when they go to the hospital. That is why every hospital is supposed to be having labels. Is this a ward for male or female? Is this the theater? Is this so? There should be directional indicators that hey, this is the theater. Because that is a right of the consumer to know where they're supposed to go next. The same charter indicates that actually, if a consumer is to go to a particular point, service point, they must be directed by the person who's sending them there. This business of telling a consumer go to the lab, but the man does not know where the lab is. How do you want him to access the lab when he doesn't know where the lab is? If sometimes you find that a hospital setting, there is a lab and it's labeled laboratory, but how many consumers understand a laboratory? That is an English scientific word. What about if you write it in the vernacular? Or you use some bit of a sign to show that, okay, this is a laboratory. So all those provisions are in the charter. So every time we go to the hospitals and you don't see some of these things, we are supposed to complain. And after complaining, you're supposed to be redressed. Now, the question is how many of us are even aware that there is a charter that gives us those details? In that same charter, there are provisions. If you are to give me medicine, if you're a doctor and you have to give me medicine, you're supposed to explain to me every regimen you're giving me. If you're giving me 4 types of medicines, I have given you my problems. I've told you I have a headache, I have body weakness, I have a pain somewhere. So if you gave me 4 types of regimen, you're supposed to tell me that, hey, this regimen A is for headache, this regimen B is for this regimen C is for this. But many times people are carrying a batch of tablets and they even don't know what actually those tablets are meant for. What are they meant for anyway? So a consumer or a patient has a right to know which kind of medicine they have actually given to them. But many other times, when doctors or pharmacists prescribe to us, and we just leave. The other assumption, rather, the other provision in the charter is that when you give me medicine, you're supposed to prescribe for me. If you say that 1 times 3, you're actually supposed to tell me, apart from writing on that paper, 1 times 3, you're supposed to tell me that you see this red tablet, you'll be taking 2 tablets every day for 3 times a day. Now, many times doctors assume they just write there and they think you've understood. What about these elders who perhaps don't understand these multiplication things? So sometimes we get challenges because the patient charter has not been effectively implemented by the people. And actually, the rights that are provided for in the charter are a replica of the rights of consumers, but tailoring them to the medical sector. So are consumers informed? Are they aware that some of these things exist? Because if they are aware, these certain things would be helping them to actually improve or to help them go for medical services when they are prepared to go there. Now, having given this kind of background, I am lucky that I understand this sector more than other sectors. So somehow I'll be sharing with you other things. So what happened now during the course of collecting the consumer complaints, 70% of the consumers who complained about health, we're talking about over 2,000 plus consumers, their issue was about customer care at the healthcare service. So when you go to the hospital, first of all, by the time a person decides to leave their home and they go to the hospital, it means they really need support. Now, a person goes to the health service delivery point, and then they reach there. No one is welcoming them. No one is showing them where to go. No one is showing them where the OPD is. No one is showing them where they're supposed to start. Irrespective of the fact that the hospital has put there some bit of signposts, not all consumers understand those signposts. Remember, in the medical sector, where at least I have served, we use a lot of shorthand. So OPD. eh, I don't know if you want to write antenatal care, then they'll write ANC, but you do not know these words, you do not know these acronyms. So if we don't have someone guiding the consumer that, hey, this is where we start from here you go here for your vitals, you are measured here, you are taken here, that kind of customer care of the patients is lacking in the hospitals. And by the way, it was both in public hospitals, but also in private entities, especially those that have grown. People think that now they have the name, they have the visibility, and so everyone who comes there is at the mercy of. So consumers were complaining bitterly. We are talking about 1,504 consumers who registered complaints around uh, issues of care, customer care at the health centers. And so this can be disastrous if people are not welcomed at the hospitals, people are not taken care of, shown where they are supposed to go, taken away from there, showing them what next. It becomes a challenge to the consumers, and sometimes they end up actually losing trust in the medical system. Now, even when a consumer has been worked on and they're supposed to go and make a payment, maybe at the cashier, there is no one showing them where the cashier is. No one is, even when they reach the cashier, there's no one giving them this customer care thing. And that is why some people are dying from home. They think when they go to the hospital, no one is going to bother about them, no one is going to care about them. And I mean, so they end up remaining at home and decide to die from home. So that is one version. The second version is for those people who are admitted in the hospitals. Someone comes with a patient, they give you an admission, you stay in the hospital, but there is no one who keeps checking on to see how is the patient doing. Did they vomit? Did they eat? Are they lacking something? Did they fail to take drugs so that we can change the regimen of the drug? Those simple things that actually keep consumers very comfortable in the hospital setting are actually lacking. Now, in the government hospitals, it is not there. And that is why some of the private entities have actually taken on, because they will care until a patient feels like, yeah, I think I'm cared for. They would rather spend a lot of money and pay where they can actually get a better service. So in the public hospitals, in the public health care systems, we are still lacking a lot of capacity when it comes to customer care services in the hospital setting, which should be something that we need to reflect, because it's already provided for in the patient charter. We are supposed to offer customer care services to the patients to enable them get social and psychological healing during the course of medication, which is actually lacking. And 70% was a huge number that we're actually reporting out. Secondly, there came an issue of medical bills, exorbitant bills. You just imagine in the hospital, which is government aided, and then the costs are higher. And yet, in government settings, in the common sense, it should be that the hospitals of government should be free service. That if I am referred to Mulago, I shouldn't worry about the money. And that's why the government did not make these hospitals private. The reason why we have public entities is that the taxpayers' money is supposed to be caring for the sick of the country. Now, we're talking about 56% of consumers of healthcare services complaining of exorbitant medical bills. Now, the question is, where are the exorbitant costs coming from? Currently, to see a specialist, even in a government setting, you need to pay between 100,000 and above. So in other hospitals, it's lower hospitals, it is 50 to 100. Now, a person who has been referred from Kabaramaido coming to Mulago, and he has to first pay 100,000 to see a specialist. And if you don't have the money, we came to realize that actually it will take even a week when you're at Mulago. If you look at this report, there is a case reported from Kasese where one of the children, a gentleman brought his child who was referred from St. Mary's Hospital in Kasese. And when they reached Mulago, the child was suffering from some cancer. They had suspected carcinoma, some cancer of the limbs and something like that. So he reaches Mulago on referral. He reaches Mulago, spends 7 days, and has never seen a doctor. He has never seen a specialist, and yet he was referred to be seen by an oncologist. So on reaching there, 7 days down the road, he says, "But what am I doing here anyway? Why was I even sent from my location? If I take 7 days with a patient who has been referred, and I cannot receive treatment." Until one of the nurses asked him, "By the way, have you paid consultation fees?" The man said, "No, I have never been told." So he quickly ran to borrow money, 100,000, paid it off, and in the next 1 hour, he had a specialist. Now, that is the starting point of pain. He has been in Monaco for 7 days. He came without money. He had to borrow money to enable him to start seeing the person who is supposed to work on the child. Now, if that is 100,000 Spain, you are not certain if they're going to give you the prescriptions there and then. You may even take more 2 weeks. Now, in those 2 weeks, you are away from your home, you're spending money, you're eating at the hospital, you're taking care of someone in the hospital, and at the end of the day, people lose a lot of money during the course of that time. And then when they actually assessed the child, they recommended particular drugs. Now, the entire Mulago did not have them. Unfortunately, they sent him to the nearby pharmacy around Mulago. And that's where he bought the medicines. But he tells me he bought the medicines at closer to 500,000. Now, he's in a hospital, which is a government hospital. He has already paid 100,000 to see the specialist. He's now going to buy medicines at 500,000, a dose for 1 week. And so he will be on this treatment for 3 weeks, meaning that every week he's buying treatment of 500,000. So a poor man requires 1.5 million to buy treatment, and you wonder if it can be in a pharmacy next to the government hospital. How come that the hospital of government can lack that kind of medicine? So that is the case I'm trying to refer to. If you look at the first case in that table, it's what I'm just trying to look at. So the exorbitant costs of medicines in the country are high, that have actually left the consumers or the sick patients, who are moreover poor, in a state of death. So many times they just die because they cannot be able to afford health care in a country. And not because the medicines perhaps are not there, but because of issues to do with corruption, or issues to do with bribery, or issues to do with people stealing medicines of government and they take them to their private entities. All those are the reasons behind the exorbitant costs of medicine. Now, we also look at another case which was reported by about 50 people, 50% of the complaints. This is the lack of specialists, especially in the district hospitals, in the regional referral hospitals, even in the lower local hospitals or health centers. Now, the policy, we're supposed to have specialists at regional referral hospitals and national referral hospitals. But sometimes you'll go there and these specialists are not there. And so one specialist has to be shared. And so they have their schedules. Someone says this specialist only comes here on Thursday. So if you have 1,000 patients, all of them, they will come on a Thursday. Not able to see all of them. I was in the health sector looking at patients. I would see over 300 patients alone. Now, I am a human being. I'll get tired. I am doing a diagnosis. I'm listening to patients. Now, you can imagine if you are one person and you have 300 people and you are working alone. What does that mean? Where do you get the energy to serve 300? If you are actually unlucky, you will even serve in the night. Now, it is clear that the country has to hire more specialists and strategically position them in hospitals down there so that people don't need to travel to Mulago. If people are coming from the Toro region, they should be able to settle in Fort Portal or Mbarara, and then they are served from that side, but the specialists must be there. These hospitals should be equipped so that the work of the specialists can actually be facilitated in the regional referral. Otherwise, sending people from Kabaramaido, sending people from Kotido, and they have to all come to Kampala to seek medical services. First of all, these are poor people. They cannot even afford an ambulance. They cannot even afford to come and stay in Kampala for a week. But remember, they will come to Kampala and wait for a specialist for even 2 weeks. So why not invest in making sure these specialists are in the local regional hospitals, in district hospitals, and they serve the people from that side? And I think that is why we are aiming at decentralization. Decentralization should not be a political game. It should also come with other things to do with how do we decentralize health? How do we decentralize some of these services to the district hospitals, the regional referral hospitals, and people are served? Now, those are some of the things. You just imagine if you're talking about malnutrition, which is of course responsible for 50% of the death of children under 5. But you can go to a district and they have only one nutritionist. If you go to my district, I come from Assisi, we have only one district nutritionist. One. Now, the cases are overwhelming and you have only one nutritionist. If you go to the regional referral hospital in Fort Portal, there are only two nutritionists, but the regional hospital is having 10 districts. I mean, at what point do we need the service delivery? At the end of the day, the lack of specialists becomes a challenge, and people are really complaining bitterly about it. Then we also looked at now the issue of misdiagnosis. We saw about 48% of the consumers complaining about misdiagnosis. At least each one of us in lifetime who have been misdiagnosed. I have 3 or 4 cases that I can share with us. There's one of our colleagues who was misdiagnosed, and when she was misdiagnosed, she was given some steroid drugs. Now, those drugs, actually, the lady had never suffered from a disease that was actually diagnosed. And now the person has lost sight. The person has lost, she has irritation of the skin. She has gotten some sores. I mean, that's just because she swallowed wrong medication because she was poorly diagnosed and put on medicines for a long time. There is one of my village mates who was diagnosed with HIV/AIDS, and she was started on HIV medication for 4 months, and then she kept on going for review. And every time she goes for review, they tell him you have never suffered from HIV; it has never gone anywhere. And she went to about 5 hospitals just to confirm this, and he wasn't sick, but he had been on treatment for 5 months. Now, all his first of all, the wife divorced. Now you see, you are causing a social problem. Someone has been married with 5 children. Now you're telling them they have HIV, and the wife divorced, and now he goes back to reassess himself. The man has never been positive at all. Now you have distorted his family, you've distorted his life. He has been on medication for nothing, and the man loses social capital. People now tag him to be sick, and the guy has never been sick at all. Now, every time people look at him, they think he's positive, but actually he's negative. He has been on medication for 5 months. The wife has gone. The children now do not respect him. Everyone has left him up there, and now he's a social misfit just because of a misdiagnosis. There is another colleague of mine I've been studying with. She was misdiagnosed and given treatment for. She was given treatment for a particular cancer. But then every time we even send her to Kenya, we've sent her in Europe, and the cancer has never been seen in anywhere in her body. But she had been put on anti-cancer drugs. Now, at the time, she has developed an autoimmune disease. So you can be seated with her, and she wakes up in the morning, and the face is swollen, the eyes are swollen, the eyes are sunken. Everything on her has changed. Now she has to be on life treatment, now not for the cancer, but for autoimmune disease. Now, you can imagine what is triggering the autoimmune disease, because there was a collapse of some body cells inside her because of the medication that she was taking for cancer, and yet she has never been a cancer patient at any one point. So the concerns around misdiagnosis, we keep on wondering what is not happening. Could it be the training of our doctors? Could it be lack of skills? Could it be lack of capacity? Because you see, from the time we're in medical school, probably some diseases weren't there, and so we keep learning on job. But how often do we build the capacity of our health staff? When did we last train our doctors, our clinicians, our specialists? How often do we give them capacity building in the new epidemics, in the new endemics? When do we build the capacities of these guys? There are so many scientific things that are happening across. So many diseases are coming up. These are new diseases. I was born, I have never heard about Mpox. Now Mpox is with us. We have never heard of COVID. COVID is with us. We've never heard of all these things, but now they're with us. The question is, how often does the Ministry of Health organize sessions to empower us as health workers in this subject? We know that currently there are so many things when it comes to deliveries of women, a lot of science. But how many times do we go back to empower the midwives, the clinicians, the surgeons in this whole thing? So there is a lot of misdiagnosis, and so there is a lot of mistreatment of people, and our people are actually developing other terrible diseases from the misdiagnosis we're giving them. Away from misdiagnosis, people are given wrong drugs for wrong diseases. Someone tells you you have a particular disease, and then they're giving you a medicine which is not actually for that disease. You see, so we have a lot of mess when it comes to the healthcare system. Sometimes we have seen on wards when we have interns operating on wards the whole day, the whole night, an intern is busy. So the senior doctors have left the work in the hands of intern doctors. But at the time I was doing internship means that you are working under supervision of somebody senior, so that you learn from them for a whole year. Whole year, you are not operating anything on your own. Whereas you have studied your medicine and whatever, but you need capacity building from a senior practitioner. But what is happening is that the senior practitioners are leaving us in the hospital to serve, and so you start imagining the physiology you studied, and then you start putting it into action with the patient live there. So we have seen many people die in the hospital, not because they were supposed to die, but maybe, for instance, they have been overloaded with fluids. Someone is just running a line on you, and the fluid is running, they have put dextrose, whatever it is, and yet you are not supposed to be given dextrose. Maybe someone is running ringers, and first of all, you have diabetes, and they're running ringers. Those small nitty-gritties. The intern things that, well, we said when someone is hypothermic or someone is having hypoglycemia, we have to run a line, and so they run it. But little do they know that this somebody is having another condition that does not allow them to do so. So there is a lot of misdiagnosis and mistreatment of patients when it comes to the hospital, and people are complaining about this. So, in our opinion, we think that there is limited capacity building of the health staff, especially after school. There is therefore need for continuous capacity building for our teams in the hospitals to be able to manage the cases of our patients. Now, the other issue was about limited information on medicines. In the charter, as I mentioned, it says that we are supposed to give patients information about the drugs. But you can imagine that about 43% of the consumers were reporting that, one, they are never informed about the treatment they are given. So you just go home and start following without being informed. What does this tablet mean? What does it work on? What is its role? So we are not told about these things. So at the end of the day, we have a challenge. Now, it is even worse when it comes to pharmacies. In the pharmacies, a patient just comes and says, okay, give me these medicines. A pharmacist has no time to ask what is the condition of the patient that is going to swallow this medicine. And so people just do self-medication. And now it's our responsibility as health workers to actually ask people, why are you buying this medicine? What is the problem with the patient? So that we give them the right medicines. Otherwise, people will self-medicate and people will die because of antibiotic resistance. So we need to provide our consumers with information about the medicines we are giving them, but also the disease that we are treating. When a patient comes and you do a complete blood count, a CBC, tell them what are the results. Because by the time you take my blood sample and I give it to you and you bring results and you're not able to interpret them for me, who has not done medicine, then why did you take my sample? I need to know what are the findings from my blood sample. What is the blood saying? How am I going to improve? Is it iron? If the iron levels are minimal, what am I supposed to do to increase them? If my white blood cells are low, what am I supposed to do? If my sodium or zinc or whatever you are checking for, what is the result and what does it mean to me? That kind of information is not being given to patients, and yet it is a right for them to know. We had issues to do with payments in government hospitals. I've talked about it. Whereas we think that the government hospitals are supposed to be free medical care, Many times patients are dying because they have failed to pay 100,000 to someone who's going to work on them, and yet his tax is going to pay them a salary or something, you know. So that was also another big issue that was reported during the course of the investigation from our consumers. We had an issue of old medical equipment. People say that when they go to the hospitals, it's very unfortunate that they reach a hospital, but they find a very old, ramshackle, damaged medical equipment. For example, someone looks at a microscope, which I think was bought in the in the early 2000 or 1990 something, and it's still in the hospital. Some of these machines lose their viability. But when you see an equipment that is damaged, that is old, patients lose the trust that can actually give them the true perspective of their conditions. So people reported strongly about these damaged medical equipment. Of course, not even forgetting that some of the structures in the hospitals of government are really out of station. They are really old. You're staying in a ward, but the ward has no windows. You know, the ward is leaking. Remember, we said health is not just the absence of disease, but the social, the mental, the physical issues. Now, imagine a patient who has hypothermia, meaning that they're supposed to be kept in warmth, but then they are put in a ward with no windows. All the glasses broke long time ago. I mean, how do you expect this patient to heal when psychologically and mentally they are actually being disturbed by the wind, by the weather issues, because of the wrong place that you've placed them? For many years, I've been working on malnourished children. They do not have windows, but you find hospitals, some of the windows broke long ago, and no one is willing to actually replace them. You see that in the hospital itself is damp. Now, patients in a damp room, it has not been renovated for so many years. It has potholes. It has holes on the roof. A lot of mess. So many people actually get sick from the hospital instead of getting treatment or healing. They get sick from the hospital. So we also had other challenges relating to waste management in the hospitals. Some consumers were complaining. We talked about 34% of consumers were complaining about the way waste is being managed, sanitation and hygiene issues in the hospital. Whereas the hospital would be expected to be a place where there is decency, there is, you know, a particular way of disposing of waste. We realize that some of the hospitals are still having wrong mechanisms of waste management. So you go to a hospital, a ward is stinking, the latrines at the hospital are stinking, they have waste on top of it, they're throwing waste anywhere. The charter provides that we're supposed to be having incinerators at every hospital or health center where medical waste can be burned. But then we find that some of these places are not there. So the whole place is in a mess. The washrooms, the toilets, the lavatories, they are all messed up. The kitchens at the hospital are not steady. So you find that now what is happening, we end up having what we call hospital acquired infections. Someone goes to the hospital with a particular disease, but by the time they are actually discharged, they have gathered another disease or other diseases, which are called hospital acquired infections, just because of the poor sanitation, poor waste management in the hospital setting. What about the air in the hospitals? All of those are issues. What about the water? How does it look like, the water that people are using in the hospitals? How is it? How is the quality of the water in the hospital setting? All of those were issues that came out from this kind of survey, and then we have challenges around that. So issues of water pollution, issues of air pollution, issues of all those ones came out as challenges. Now, I want to, in the remaining few minutes, I want to look at the environment issues that also came out. One of the issues was around water pollution, but I think majority of the consumers, about 33% of them, presented an issue on sound pollution, especially in the cities. Now, currently, you realize that churches are just mushrooming everywhere. You wake up in the morning, the neighborhood where people are staying, there is a church. And then you find three people in the church, but making loud noise in the night as if there are 100 people. So there's a lot of bizindalo, a lot of loud music playing in the churches, but it's only one person actually singing in the church. And this is around midnight, but there are two people in the church making all the sorts of noise. and no one is bothered. But remember, there are neighbors who want to rest. So it would be nice if churches were actually given a condition that if you want to play your music, then your church must be having a soundproof, so that you don't distort the comfort of other consumers in your neighborhood. We have seen people having discourse in the places of residence where people are staying. Other people have come to rest, others are tourists. People want to have a rest, and then you are playing loud music. You're making all sorts of noise. I think there should be a deliberate effort of how do we deal with sound pollution in the cities. There's a lot of noise, very unnecessarily, and actually, this noise can actually distort even the ecosystem. The birds run away, the insects run away, all of these natural resources that we need in our environment actually disappear because of this loud music. Now, if you go to Kampala, there are these border borders, these big bikes which make a lot of noise, a lot of mess. Now you wonder, we have policies around order, and who is deciding where to establish a church? Who is determining which kind of noise has to be made in a center? Who is determining where to put a casino? Who is determining where to put maybe a happening place where people will be making all sorts of noise? So there should be deliberate efforts to regulate some of these things. We cannot say we don't establish churches, but our issue is how do you regulate where to establish what? Those are some of the things. We cannot compromise the quality of other consumers at the expense of others. We need to respect the consumer rights, the consumer issues, and then we can be able to live even better. Now, there are issues a little bit quickly. There are issues which came out also on late coming of staff. When it comes to hospitals, people come very late. The medical team comes very late. So you're there, the patients come as early as 6, 7, but then the medical workers, they end up coming at 11. So someone is at the hospital for 5 hours waiting for a medical staff. And by the time the medical health worker comes, people have been around for 5 hours, they have not eaten breakfast, and they are sick. And then when these health workers come, they also go into their other things. By the time they work on patients, it's 1. They have long queues, and then by the time they work on somebody, really, someone has been in the hospital for the whole day. So many patients actually, when they decide to go to the hospital, it means they will be there for the whole day. So this is a patient who is sick but is in the hospital for a whole day. Why would this be so? And unfortunately, after spending all that time, they say, "Oh no, we don't have this machine. Go to the neighboring clinic, do the tests, and bring them." The person goes out, they do the test, they come back with the results in the hospital. They say, "Ah, no, this medicine, we don't have it, go and buy it." So a whole day someone is in the hospital, and that is making consumers feel very annoyed and very bad. Issues of bribes and corruption in hospitals still came out. Issues to do with fewer healthy staff. Uh, Whereas we are 300 or 400 people who have come to the hospital, but we have only 2 people who are seeing us. And that is also another challenge that people reported. And so people have given up on coming to the hospitals. And so people prefer dying from their homes than coming to waste time and energy in the hospitals. What about the issue of road network to the hospitals? Many people, I saw the news yesterday on X, one of the districts in Uganda, the hospital cannot be accessed. Whereas they have a hospital, but the roads to the hospital are all impassable when it rains. So if you have a pregnant woman who needs quicker support, who needs to be, maybe she needs an operation or she needs to deliver, one, they cannot even transport her to the nearby hospital because of the impassable roads. How do we ensure that the infrastructure of hospitals and all those supporting infrastructure are actually up there? So there is also that was mentioned by most of people. Issues of stock out of medicines also came out. That you go to a hospital and the medicines have run out. The hospital is having a stock out of medicines, but also you hear that the NMS or maybe NDA is banning medicines because they have expired. So you ask yourself, this medicine is not in the hospital, but is being burnt because it is expired. Now you see, but what are we dealing with here? So a lot of stockouts of medicine versus the expiry of medicines. It's a paradox that whereas other hospitals don't have the medicines, other medicines are being destroyed or being burnt. But also we have witnessed that there's a lot of medicines of government that are being stolen and they're actually being exported to other countries. We have seen in Congo, we have seen in Southern Sudan. Some of our people here come and steal medicines, written not even government of Uganda, but they're being sold in Congo. I am happy that the NDA is doing a lot of inspections here and there, but I think we need to do a lot of boosting of that so that we can secure our people. And lastly, there was an issue of negligence of health workers. There's a person in Kampala who reported the case of negligence. She took the patient, this was a woman who was going to deliver, and they reached the hospital, and the nurses, the midwives were there, kept on asking them, please, my patient is doing badly. If you can look at that topmost comment on the blue, that first whatever there, it shows you that case. How this lady was in coma, rather in labor, and she wasn't able to deliver just because the health workers couldn't support her, and she had no option than to deliver on bare ground. She just pushed her baby. Unfortunately, the head of the baby fell or was hit on the floor, and up to now the baby has cerebral issues. So that was one of the issues of negligence that we registered, and I think we have reported some of these cases to the responsible people. We hope that justice can be met. So, ladies and gentlemen, quite a number of issues that we can share. Recently, near our office, we had a challenge of impersonation. A particular doctor that you must have heard about on your Twitter space, who has been a doctor for the last 10 years or so, operating people, but the man has never been a doctor in any way. He has even gone ahead to open a hospital, but he has never been a medical person. He has even been employed by ministry, but he was just impersonating another person's documents. So how are our systems? How are our systems of health? How are we operating? Who is regulating who? Who is taking keen interest in improving the health system should be an issue that we need to address as a country. What is the role of ministry in all this? Does ministry prioritize some of these issues? If not, it is high time the Ministry of Health and Ministry of Finance sat together to eradicate and prevent people from actually death. When you hear that people are dying early, don't get surprised. These are some of the issues that we're able to gather from the communities about the service delivery around health. So, Mr. Chimera, those are some of the concerns that we gathered. Of course, those and so many others, but at least this can give us a preamble of where we can start from when it comes to advocacy for health, healthcare services in the country. Yeah, thank you so much, Henry. Over to you.
Thank you very, very much, Bernard. And very soon you should go and start lecturing because
Yeah.
you flow with information. I would like to thank you. Where you ended is where I would like to start with policy and issues come in, like the question you're asking. Who is responsible for implementing these healthy policies? What regulations exist to guide the implementation? What resources are allocated to the policy? Is the policy resourced, and how is this reported on? And these are some of the consumer voices that we are bringing out. You see, colleagues, this is something, these are the questioning thoughts of seeing good regulatory or good policy implementation. How are the health sector well resourced, and how is it reported about? So the consumer voices are reporting about it. What implementation indicators does government have in place? So we can use the consumer voices to look at some of those indicators. Like Bernard, you said an earlier, retooling of health service providers is going to be very key. And I would like to use one of the quotes that I read over the weekend, and I find it's very important. It's just a statement. Education goes hand in hand with regulation. And we need to know that regulation is not always impeding, it is facilitating. So if education goes hand in hand with regulation, so the regulations should be there to implement the patient's charter. Regulation should be there to scale up and uphold consumer rights and responsibility, deal with issues to do with expired products, misdiagnosis. So with education, consumers need to speak out and make sure these things are addressed. Still, I would like to conclude with issues, Bernard, you raised as we wrap up. Given the challenges in the health sector, the strategic direction should be we need to reach out farther and more, scaling up our reaching out to share these consumer voices to the executive to call to action. Coming to the legislature, we need to reach out to the local governments. We need to reach out to the cultural leaders, to reach out to religious institutions, schools. We need to reach within as recommendations that with these consumer voices, the health sector, reaching in within to check are consumers trusting us? Where are our ethical values? Do we need to change policy? Do we need to change regulation? How do we build the social fabric? Then the other aspect, still within the medical sector, to call to action, building up our capacity so that consumers have got trust and confidence in the sector. Then also building around this. Consumers are stakeholders. We need to build around with all these policies. We need to build around to bring trust. Without consumers, systems don't work. Consumers are the foundation. If consumer welfare is not good, there won't be better business. There won't be business. A country will be a failed state. With all these voices, there is call to action. Governance is very key. So, ladies and gentlemen, having gone through that, I would like to thank you from wherever you are watching. It is still a good morning to some of you. It is a good afternoon, and it is a good evening. We are transiting from 2024. We need to thank our Creator for the gift of life. And we will need to pray and also act responsibly as we transit from 2024 to another step in life to 2025 by being responsible. Always with Bernard, we equate food safety with road safety. Just imagine you eat wrong food as you're driving. The wrong food paralyzes you or leads to something wrong. You might end up driving into something else. So as we were looking at health and the environment, the health of the food or the health of the environment can impact your health, can impact food, can impact the vehicle. Some of us, we put even bad water in the radiators of our vehicles. That is bad food for the car. Bad water is bad food for the car. It might end up overheating because of those particles that have entered into the system, and the radiator can't cool the engine of the car. Then it ends up overheating. The overheating might lead to other reactionary aspects in the car. So this is not only to vehicle owners, but it is to also public transport. So safety throughout our lives is going to be very key. Let's be cautious. Many things are being defrauded or being frauded. The fraudsters, the unscrupulous, are there to get every penny of us. And I liked when Dennis said these days he's a very cautious consumer. If Dennis has any problem, then we won't have a producer for this TV program. So Dennis, thank you for being a very cautious consumer to facilitate our awareness to other consumers, to facilitate the empowerment. Consumer information is very key. Consumer information leads to quality of life, leads to better business, leads to a better economy, and leads to a better planet we live on. We need to nourish it by sustainable consumption. We need to sustain it with sustainable production. Consumers, we have a role to play in making our planet, the only planet we have, to be sustainable, resilient, by influencing better production, leading to better consumption, leading to quality of life. Sustainability is not a luxury. It is a mandatory part of our life. Let's be part to that sustainability in all our actions, socially, economically, and environmentally. And all this requires calling to action with good governance, clear-headed governance that respects all aspects of humanity. Thank you very much for this concluding program of 2025, and I would like to thank you for being with us. We are going to continue. Next Friday, it will be a new year, and that will be 3rd of 2025. We look forward to being with you when we will be handling water and sanitation. Still, the consumer voices. Thank you very much, Bernard. Thank you very much, Dennis. And thank you very much, Brian in Nairobi, and others that I don't know in which studios you are, wherever you are, but I would like to crown it all. Paul Mukasa, where you are in England, thank you for reaching out and thank you for the partnership. Let's continue and sustain it. Thank you very much. Happy New Year and happy festival season. God bless.